Sutherland, naturopath and FX Medicine Ambassador. We are here today at the 2024 NHAA Herbal Medicine Summit, and we have with us Justin Sinclair. Welcome.
Thank you. Thank you so much for having me.
It's a pleasure. Now, I would love for you to tell us a little bit about endometriosis and cannabis, if there's any latest insights that you have for us, because I know you're doing your PhD in this space too.
Yeah, absolutely. So, I think it was 2019, September, I started my doctoral studies and looking at the safety, tolerability, and effectiveness of medicinal cannabis. And we had heard that there were anecdotal reports of people that were using cannabis for period pain and endometriosis, but there's nothing in the literature. So, I managed to recruit a really great group of supervisors, Associate Professor Mike Armour's my primary supervisor, and a whole bunch of others, Professor Jerome Saris and Professor Jason Abbott, and Adjunct Professor Dave Pate. Dave Pate, incidentally, did his PhD on Delta-9 THC and glaucoma, so he's quite a figure in the space, but we didn't know anything. So where's the best place to start? Mixed methods. And so we actually have done a retrospective archival electronic database analysis from North America, where it's legal, particularly in Canada, and we were able to see what women were using it for, how they rated it, its effectiveness, and those types of things, glean a lot of that data. So we found that in that particular subset that they were using inhaled cannabis, that seemed to be better, higher THC containing was better for pelvic pain. And then we actually found that oral products that were more rich in cannabidiol or CBD, they were using for gastrointestinal and mental health. We then did focus groups Australia and New Zealand, just to see what the cohort would think about cannabis. Are they worried about it? Are there issues around it? Is there stigma? All that kind of stuff. And that's exactly what they reported. So they basically said that there still is stigma that makes them a little bit wary about it, which is fair enough. They're worried about drug driving laws, which definitely the government needs to pick their game up on. They're worried about workplace health, drug testing laws. It's another one. And then they're also worried about the cost sometimes, because back in the early days, particularly that 2019, it was still quite expensive. Those prices have come down now. But we used all that information then and designed a survey, and that survey went out internationally. And so what we're still seeing is that 56% of the 889 women of a paper that we're just getting ready for publication from 26 different countries, that 56% are still utilizing illicit cannabis instead of medically prescribed or medically supervised legal cannabis products. And there's all sorts of things, but the thing I'm really interested in is this thing called substitution effect. So substitution effect is when people are using cannabis and they're replacing their normal pharmaceutical medicines. And so some of the studies that we've shown, again, about to be published, but from the Australian and New Zealand subset, which has been published, is that they're completely, 30% are completely stopping their opioids, or 17% are completely stopping benzodiazepines, or 20% are completely stopping their SSRIs. And whilst you can sit there and say, wow, that's incredible, there's clinical use for that, there's the flip side. Because remember, a lot of them too, in our research, has said they're not telling their doctors. So if they're not telling their doctors, and you don't want to stop some of those drugs suddenly, there's interactions, there's safety, and so there's good and bad. But we're now finally in our clinical trial, so the feasibility study, that's ongoing, and so hopefully, God willing, all things, the gods and goddesses making sure everything's okay, I should be able to submit next year.
Okay, well, as a clinician, I find this a minefield. We have many times women with endometriosis coming in with that exact situation where they are procuring illegal product, but it's the only thing that's actually working for their pain and giving them some quality of life. They can get to work, they can do what they need to do, but it is a minefield as a clinician as well, and it's something that I can't wait till the research comes out, because it's something that we all need to be more aware of.
Yeah, you're absolutely right, and I think that's one of the key points is that, as naturopaths and herbalists, we can't prescribe, but finding good doctors that we can work with that can prescribe and that we can also help maybe navigate herb-drug interactions, those types of things. So that, true integrative medicine, I think that's really important. But you absolutely nailed it. I mean, it is a minefield. And yes, the prices are coming down, and yes, more doctors are prescribing. But there's still, I think, there's only about 5,000 doctors around Australia that are even working in that cannabis space. So what about those that are more regional or remotely located, and how do they get access, particularly if they can't drive, and all those types of things. So yeah, there's still a lot of work that needs to be done to polish the system, but at least they can have access now to a plant that's been used by our ancestors for the better part of 10,000 years. So all that's old is new once more.
I love that. And it could be the case of true collaborative medicine when we can come together from the herbalist side and the medical side and work together to help these patients.
Oh, look, I did a talk today on cannabis ethnopharmacology, just looking at how cannabis has been used as a medicine throughout many cultures and throughout the ages. But the one thing I ended the talk with, which was something that was really positive, is in some of the talks I do for medical practitioners, I had one medical practitioner that said something really poignant that really stuck to me. And what it was, you've convinced me that there is medical benefit for this plant. And it makes me wonder, what about all the others that you herbalists prescribe? On the nose. That's the question. And if they're thinking that, then it's a story of hope after all, maybe. Yeah.
Well, thank you so much for the work that you do, and you'll have to come back and speak to us again at next year's summit.
Yeah, no problem. Thank you so much for your time.
It's a pleasure. Thank you so much for joining us today. Don't forget to check out all the resources on the website.